Thank you very much to Helga for giving me the 3 degrees, but almost feel like we're the support act for the Scottish Dementia Working Group, but it is a real big privilege to be here talking to so many people today. Just like to introduce Alzheimer Society. We are a care and research charity based in England, Wales and Northern Ireland. I work in the research team, and we currently fund about £7 million of research, which goes right all the way from biomedical research through to research which is designed to improve the care of people with dementia today. And Barbara's going to briefly introduce herself as well.
Yes. I am a lay worker, and the reason actually I'm standing here is simply because my mother had Alzheimer's disease, and I looked after her for quite a few years. And it was after she had died that I thought, I've got all this knowledge about this illness. I know so much about the health service. I know so much about voluntary sector organisations such as the Alzheimer Society. And I had reflected on what happened to her and to us as a family. And I felt really bad that all that knowledge might disappear. And so I was absolutely delighted in 1999 when the Alzheimer Society set up a group called Quality Research in Dementia, because I had become so aware that we needed research that would find out why people had dementia, how you could cure it, and how you could care for people with dementia. And so I became a member right from the very beginning, and I've been a member now for 15 years. I didn't think I would be here this long, but so much still needs doing, I am still around.
And we're very glad that you are around, Barbara. So, as Barbara has already told everyone, we set up our research network in 1999. There's a backdrop of, I think, a lack of enlightenment about the ways in which people affected by conditions can influence change in the healthcare system, and particularly in research. And we were pleased to be trailblazers in what has now become the public and patient involvement in research. The research network is open to carers, former carers, and this is really important because when we look at research into bereavement support at the end, research at the end of life, we really need to harness the opinions of former carers, and also to people with a diagnosis of dementia. And I'm really pleased that Keith and Hilary and Daphne, who many of you know, are part of our research network. Research network volunteers bring their own experience and expertise alongside the scientific research expertise that makes sure that we fund research which is of the highest priority. Their roles include influencing what research is funded, but also in improving design and delivery. And there is a growing literature around the impact that involvement can have in research. Really pleased that we see the benefits not just in the lives of people with dementia and their carers and the empowerment that involvement brings, but also to us as a charity and to the researchers who we work with. We think that the benefits are all round. And the reference we got there, Tal Nuriel, is a biomedical researcher doing really complicated science that no one can really understand. And his experiments were failing. So what he did to go and get motivation was to go and talk to some people with dementia at local support services in America. And he wrote it up in Nature, which some of you might know as one of the highest impact journals in research. So I think that message is starting to finally be heard. This slide here shows how we put the experiences of people affected by dementia at the heart of our research program. I don't have time to go through all of these, you'll be pleased to know, but we think that this goes all the way around from setting what the research priorities should be through to helping us to decide which research projects we fund, to actually going into the labs and meeting researchers, and in some cases actually delivering the research. We've got some really nice examples of people with dementia and carers being interviewers. So why should it just be researchers who do that? We believe that people with dementia and carers can be researchers too, all the way through to raising awareness of the importance of research and what is out there so that hope can be shared. I'm now going to hand over to Barbara.
what I'm going to say is very personal because I'm just one of 260 people who are members of the research network. And I'm going to give you 3 examples, really, of how I have been able to work within the network. As a member of the network, you have a chance to be allocated to a project. And I felt that I was extraordinarily fortunate because I was allocated in 2002 to a project which was simply called FITS. And that project was going to be looking at the way people were treated in care homes when their behaviour was what was called challenging or bad or difficult, words that I hope we wouldn't use now. Often they were given antipsychotics, which were really chemical koshes. They knocked them out, and they had the most appalling side effects. And this group of researchers who came from Newcastle, from Oxford and from London, and had quite a lot of care homes that they were going to work in, felt there was a better way. We didn't need drugs to dope people to make them okay to handle. And so 3 years were spent looking at this project, and from the very beginning, people with dementia in the care homes were seen as individuals. They were people. It happened to be that they had dementia, but first and foremost, they were people. So the methods used were what I loosely called person-centred care. And the aim of the project really was to reduce antipsychotic prescribing, to get rid of these, what one of the researchers called dirty drugs. And in place, they looked at the person and thought, well, why is this person behaving as he or she does? And often they could find that they were frustrated, they were in pain. There was a really very clear reason, if you took time to look, for why that person behaved as they did. And then they could begin to sort out the problems without recourse to antipsychotic drugs. As well as that, they made much more interaction between the people with dementia, between their researchers, between the staff, so that there was a lot more talking and discussing and doing things together. And I would love to stand here and tell you about some of the things that they did. I could give you umpteen case histories of how people's lives were so changed by the regime that they introduced, but I don't have time. But I can actually say to you, there was an incredible change in the homes. And one of the real changes was that at the end of the 3 years, when they looked at the amount of prescribing of antipsychotic drugs, from being up here, they were down here. They had dropped enormously. People were much happier in the home. They were healthier. The staff were happier. And I think that was a really interesting side effect, if you like. The staff were happier because they could understand where people with this illness were coming from. And I was very naive in those days because I thought, done the research, spent 3 years, got wonderful evidence that if you give enhanced care, you will get a much better quality of life for people with dementia and for their carers. But actually, it didn't go out. I thought it would go all through the country because it was so good. The homes in Newcastle and Oxford and London, yes, they carried on, and other people heard about it, and there was a little bit of an improvement everywhere. But I was really surprised and disappointed that nothing actually changed. So then, two of the people who'd been on that project as researchers, both psychologists, wrote a manual because then we thought, right, we've done the research, we need to tell everyone about it, we need to disseminate the information from this project. So the manual was produced. It's a lovely manual, it's glossy, it got everything you need to know about looking after people with dementia in care homes. But it still didn't happen. And that again, I was really puzzled by this. But you needed a lot of training, you needed a lot of support for the staff, you needed to change cultures. And so the Alzheimer Society and the Research Network thought about it, and the Alzheimer Society put money aside, and we went on to translating research innovation into everyday practice. And Dawn Brooker, who is at the University of Worcester and is here at this conference, did yet more research in 67 care homes and showed that if you use this enhanced care package, you would reduce the use of antipsychotics, you would make life better for everyone in the care home. And those carers who'd had to let people go into care homes felt so much better because they felt the people that they cared about were having a better experience. And that little hexagon at the end is what is going to happen, because though there are another 67 homes where research has been done, and there are actually quite a lot of others doing it, there are still a lot of homes that are not. And so it's hoped actually to produce a programme that will be so user-friendly, it will roll out through the country. So I've had an involvement that the whole time, and I'm really thrilled to have been, and I hope that it will get rolled out to everyone in the end. The second project I've been on, Brains for Dementia Research, because it is known that the reason people have the symptoms they do is damage in the brain. There is actually damage there in different parts of the brain. And researchers are very busy looking at the brain, and they of course need a post-mortem brain, so that they collect brains from people who in their lifetime have said they will donate their brain. And they actually have brains from people with dementia, and then they get their whole medical history, so that if it's dementia with Lewy body, vascular disease, PCA, whatever, they know that person's mental history. Now, they also need brains from people who don't, in their life, have problems, who can give a normal, so-called normal brain. And there are 6 brain banks in England, and they are all collecting brain tissue. They all give out brain tissue to researchers who want to look at very, very specific things. And there are problems about that. There might be religious questions. Do you give up your brain? Suppose there's an afterlife and you haven't got a brain. You know, there are all sorts of strange things. Now, I have actually donated my brain, and I'm really surprised by a lot of the responses. My husband is a huge believer in research into all sorts of medical conditions, but he has actually had a real problem with me donating my brain. And he agrees, it's simply an emotional thing. My brain and my spinal cord being taken out of my body is a problem for him. My grandchildren are completely absorbed by the fact, and they have learned a lot about brains because my mother had dementia, and I've ended up here. And that again, I have met such lovely people who are researching, who are so on the side with people with dementia, who are so committed, so passionate. And so in the FITS project, that was true. In the Brains for Dementia research, that was true. And I've also had this really massive opportunity of getting outside and working with people actually who can change things by law. In 2009, I was invited to speak at a ministerial summit on dementia. I spoke as an ex-carer. And following that summit, when lots of researchers spoke, and there was a minister who came and spoke, and this, of course, is in England, a ministerial advisory group on dementia was set up. And that was set up under the Labour government. And that was really interesting because they were committed to research into dementia. And we all knew there was an election coming up, and no one quite liked to say, you know, what's going to happen after the election. We've got this group, it's buzzing, it's doing things. But actually, the minister himself, the Labour minister who chaired that group, said, there's an elephant in the room, it's the election. And I would like to tell you, we have made an arrangement with the Liberal Democrats and the Conservatives that we will carry on this work. So there was actually a change of government in 2010, and the Conservatives came in, had to have a coalition with the Lib Dems, and they carried on. And I think that's to the credit of political parties that didn't want to waste any time on arguing about this. They got it sorted out beforehand, and it could just smoothly continue. And the minister at that time was a man called Paul Burstow, who to my knowledge has been working for years and years and years to make life better for people with dementia. Following that, the Prime Minister got involved. And whatever you think about David Cameron, I have to say he is so committed to caring for people with dementia and also dementia research. And he set up a Dementia Research Champions Group. And I have the very great privilege to be on that. And he is so keen. He's provided money, he's given more money than he expected to give because he's been so impressed by the quality of the applications of money for research. And the NIHR, the National Institute for Health Research, the Alzheimer Society have worked with them. We had what Matt called speedy dating, when people like myself sat at a table and all the researchers who wanted advice on what people wanted with dementia, and we had a lot of people with dementia there, came and talked to us, and that informed their applications. And the last thing, you know about the G8, it is now the G7. But again, that was David Cameron with his leadership. So I think huge things have happened in those 15 years. And I was actually a teacher in my normal life, as it were. And I am very keen on history. And to see the history of the network and what it's done in 15 years, I think is fantastic. And we do have a booklet, and if you want one, you're very welcome. And I would just say one last thing. I coordinate the research network people in Yorkshire, and I have got 5 new members in the last 2 or 3 months, 3 of whom are people with dementia. And because we have a connection with the University of Bradford, 2 of those people have already talked to the lecturers at Bradford about their experiences of memory clinics. One a good experience, one not. And so people with dementia are making a massive difference. Their voice is being heard. And I have to say, in a way that it wasn't 15 years